Hey everyone, happy Friday. It's Dr. Ashley, pediatric emergency mom. I wanted to talk a little bit about human metapneumovirus, which is a mouthful, so also called HMPV. So many of my lives come from questions from friends or followers. And then some things are easy and I know exactly what to do and I just hop on it. And other things I have to kind of look a little bit more into. For this live, I know tons about human metapneumovirus. I was confused as to the context of the question. And so a friend sent me a meme, and it was like 2025, things to worry about. It's just, one of these very sensationalized, like some things are real, right? And then other things, one part I was like, what is this? And it was a virus in China. So I started searching in the news, what are they talking about? And so basically in the news, they're reporting surging cases of HMPV in China. I'm thinking like, what? So it's clear these articles want people to get worried, right? And I actually posted on my Instagram the kind of progression from very normal and reasonable to panicked um, uh, news article titles. And so, in a nutshell, in northern China, where it is quite cold, and so people are inside quite a bit, they do have increasing cases of human metapneumovirus. Human metapneumovirus is another one of those respiratory viruses that we see that cause respiratory problems. So nasal congestion, cough, maybe some increased worker breathing. It can trigger wheezing in asthmatics. It can trigger bronchiolitis in the little ones. That's when you may be wheezing or having increased worker breathing, not because of bronchoconstriction like in asthma, but because of all of the mucus that's present in the bronchioles. It can also, in some kids, trigger croup. So it is our good old respiratory virus that honestly, before we started to do more viral testing, so if we run a respiratory infection panel, for example, we're testing for 15 to 20 different viruses. In the past, we may have only tested for RSV or flu. Now, in some patients, we're running this big panel, and then we'll see positives for human metapneumovirus. It's not a virus that we have a rapid test on that we'll routinely test for in your doctor's office, for example. So this is not a new virus. It's been around for ages. Um, I hate that the news has kind of like taken this and run with it and made people nervous. But these are the kind of things that I like to cover to bring you guys some peace of mind. Um, we have, at some point in your life, you've had this virus. You've probably had it multiple times. Your kids have had it. Most kids have had it by the time they turn age 1. So there's nothing novel about this. There's nothing new about this. The way to combat the virus is like anything, good hand washing, covering your mouth if you're coughing, not going around people if you're having fever, right? These kind of things. So I hope this helps, and I hope you all have a great rest of your day.